Video lecture chapter 19, part 3, infection control in the dental office. Hand hygiene, hand washing guidelines. Wash your hands each time before you put on gloves and immediately after you remove gloves. Wash your hands when you inadvertently touch contaminated objects or surfaces while barehanded, and always use liquid soap during hand washing. Bar soap should never be used because it may transmit contamination. For most routine dental procedures, such as examinations and non-surgical procedures, an antimicrobial soap can be used. For surgical procedures, you should use a germicidal surgical scrub product. Dry hands well before donning gloves. Additional hand washing guidelines. Keep nails short and well manicured. Rings, except for wedding rings, fingernail polish, and artificial nails are not to be worn at work. Dental personnel with open sores or weeping dermatitis must avoid activities involving direct patient contact and handling contaminated instruments or equipment until the condition on their hands is healed. Alcohol-based hand rubs. Waterless antiseptic agents are alcohol-based products that are available in gels, foams, or rinses. The product is applied to the hands, which are then rubbed together to cover all surfaces. These products are more effective at reducing microbial flora than plain soap. Concentrations of 60 to 95% are most effective. They contain emollients that reduce the incidence of chapping, irritation, and drying of the skin. These products are very dose sensitive. For most routine dental procedures, such as examinations and non-surgical procedures, wash your hands with either a non-antimicrobial or antimicrobial soap and water. If your hands are not visibly soiled, you may use a waterless alcohol-based hand rub. For surgical procedures, you should perform a surgical scrub using either a non-antimicrobial or antimicrobial soap and water. Dry your hands and apply an alcohol-based surgical hand rub. Personal protective equipment. Personal protective equipment. OSHA requires the employer to provide employees with the appropriate personal protective equipment without charge to the employee. Examples include protective clothing, surgical masks, face shields, protective eyewear, disposable patient treatment gloves, and heavy-duty utility gloves. The purpose of protective clothing is to protect the skin and underclothing from exposure to saliva, blood, aerosol, and other contaminated materials. Types of protective clothing include smocks, slacks, shirts, laboratory coats, surgical scrubs, hospital operating room clothing, scrub, surgical hats, pants, shoe covers. The type of protective clothing you should wear is based on the degree of anticipated exposure to infectious material. The BBP prohibits the employee from taking protective clothing home to be laundered. Protective clothing should be made of fluid-resistant material. As a means of minimizing the amount of uncovered skin, clothing should have long sleeves and a high neckline. The design of the sleeve should allow the cuff to be tucked inside the band of the glove. During high-risk procedures, protective clothing must cover dental personnel at least to the knees when seated. Buttons, trim zippers, and other ornamentals should be kept to a minimum. The BBP standard states that protective clothing may not be taken home and washed by employees. It may be laundered in the office if the equipment is available and if standard precautions are followed for handling and laundering the contaminated clothing. Contaminated linens that are removed from the office for laundering should be placed in a leak-proof bag with a biohazard label or an appropriately color-coded label. Disposable gowns must be discarded daily and more often if visibly soiled. Protective masks are worn over the nose and mouth to protect you from inhaling possible infectious organisms spread by the aerosol spray of the handpiece or air water syringe and accidental splashes. A mask with at least 95% filtration efficiency for particles 3 to 5 millimeters in diameter. The two most commonly used types of masks are dome-shaped and flat. Masks should be changed for every patient or more often. To handle a mask, touch the side edges only. The mask should conform well to the face, should not make contact with the mouth while being worn, and a damp or wet mask is not an effective mask. Protective eyewear is worn to protect the eyes against the danger of damage caused by aerosol pathogens. This also prevents battered solutions or chemicals from injuring the eyes. OSHA requires the use of eyewear with both front and side protection. If you wear contact lenses, you must wear protective eyewear with side shields. After each treatment or patient visit, clean and decontaminate your protective eyewear in accordance with the manufacturer's instructions. Face shields, a chin-length piece of plastic, may be worn as an alternative to a protective eyewear. Cannot be substituted for a face mask because it doesn't protect against inhalation-contaminated aerosols. Patient eyewear. Patients should be provided with protective eyewear because they may also be subject to eye damage during the procedure. This could result from handpiece splatter, spilled or splashed dental materials, or airborne bits of acrylic or tooth fragments. Because dental personnel are most likely to come in contact with blood or contaminated items with their hands, gloves may be the most crucial PPE. You must wear a new pair of gloves for each patient. Consult with the glove manufacturer regarding the chemical compatibility of the glove material and the dental materials you use. All gloves used in patient care must be discarded after single use. These gloves may not be washed, disinfected, or sterilized. Latex, vinyl, or other disposable medical quality gloves may be used for patient examinations. Torn or damaged gloves must be replaced immediately. Do not wear jewelry under gloves. Change gloves frequently. Remove contaminated gloves before leaving the chairside during patient care, and replace with new gloves before returning to patient care. And hands must be washed after glove removal and before regloving. Gloves are effective only when they are intact. If gloves are damaged during treatment, they must be changed immediately. The chemicals you come in contact with on a daily basis may damage your gloves. Because so many dental materials are available on the market, you should consult with your glove manufacturer about the compatibility of the glove material with various chemicals. Examination gloves are usually made of latex or vinyl and referred to as exam gloves. These are worn by dental professionals during patient care and available in sizes from small to extra large. Over gloves are also known as food handler gloves, are made of lightweight, inexpensive clear plastic. These may be worn over contaminated treatment gloves to prevent contamination of clean objects handled during treatment. They're not acceptable alone as a hand barrier for intraoral procedures and must be worn carefully to avoid contamination during handling with contaminated procedure gloves. They are donned before the secondary procedure is performed and removed before the patient treatment that was in progress is resumed, and discarded after single use. Sterile gloves should be worn for invasive procedures, including cutting of bone or significant amounts of blood and saliva, such as oral surgery or periodontal treatment. They're supplied in pre-packaged units to maintain their sterility before use and provided in specific sizes. Utility gloves are not used for direct patient care. They must be worn when the treatment room is being cleaned and disinfected between patients, while contaminated instruments are being cleaned or handled, and for service cleaning, surface cleaning, and disinfection. Utility gloves may be washed, disinfected, or sterilized and reused. Used utility gloves must be considered contaminated and handled appropriately until they have been properly disinfected or sterilized. Non-latex containing gloves. Healthcare providers or patients may experience serious allergic reactions to latex. For the person who is sensitive to latex, there are gloves made from vinyl nitrile or other non-latex material gloves. During a dental procedure, it may be necessary to touch surfaces or objects such as drawer handles or material containers. If you touch these objects with a gloved hand, both the surface and glove become contaminated. To minimize the possibility of cross-contamination, you can use an overglove when it's necessary to touch a surface. Opening drawers and cabinets and opening containers, and use of sterile cotton pliers to remove from the container. High-tech equipment. Every aspect of dentistry is entering the arena of high technology equipment and devices. You must carefully consider what infection control procedures are needed to make each piece of equipment safe to use. Always follow the manufacturer's infection control recommendations for every device and piece of equipment.